Hello, I'm Reema. I'm a pharmacist at Randall Mill Pharmacy.
Hi, I'm Holly, and I'm also a pharmacist.
Today we'll be talking about migraines. June is National Migraine and Health Awareness Month. According to World Health Organization, it is estimated that almost half of the adult population have experienced a headache at least once within the last year. So Holly, what is a migraine?
Well, a migraine is a type of headache. It may occur with symptoms such as nausea, vomiting, sensitivity to light and sound, and many people, they describe it as a throbbing pain on one side of the head.
Okay. What are some causes of migraines?
Sure. A migraine is caused by abnormal brain activity. This activity can be triggered by many things, but the exact chain of events that triggers a migraine is still unclear. Most medical experts believe that migraine attacks begin in the brain and involve nerve pathways and chemicals. The changes affect blood flow in the brain and surrounding tissues. Migraine headaches tend to first appear between the ages of 10 and 45, mostly affecting women. Sometimes they can begin earlier or later. Migraines can run in families, and migraines, like I said before, occur more often in women than in men.
Okay. What are some environmental or lifestyle triggers?
Sure. So migraine attacks may be triggered by a multitude of different things. So you mentioned lifestyle and environmental. So just to name a few, caffeine withdrawal is a big one that can trigger migraine headaches. Any changes in hormone levels, so especially around a woman's menstrual cycle, they can be more prone to migraine headaches, or if they use birth control pills. Any changes in sleep patterns, drinking alcohol, exercise or physical stress can also cause a migraine. Loud noises, bright lights, missed meals. Another common is any odors or perfumes. Some individuals are very sensitive to perfumes or very strong candles, things of that nature. Smoking or exposure to smoke, as well as stress and anxiety.
Okay. So we heard about environmental triggers and lifestyle triggers. What are some food or dietary triggers?
Sure. So migraines are most commonly triggered by, as Reema said, dietary things. So certain foods such as chocolate, that's probably the number one thing that we hear that triggers migraines is chocolate. I know it doesn't sound fun, everyone loves chocolate, but it is a big thing when it comes to migraines. Dairy, especially certain cheeses, can trigger migraines. Foods with MSG, so I immediately think of like Chinese food that tends to have a lot of MSG in it, so some people can develop a migraine after a big Chinese food meal. Foods with tyramine, so for example, red wine, any aged cheese, smoked fish, figs, certain types of beans, as well as fruits, avocados, bananas, citrus fruit, processed meats. I mean, I could go on, bacon, hot dog, all the good things. Onions, peanuts, pickled or marinated foods. I know, all the good things, right?
And the list goes on.
Yeah, the list goes on. And that's why, to kind of go full circle, why migraines typically can be hard to, pinpoint the causes. And that's why sometimes if you experience a migraine, your doctor will ask you to keep a migraine diary of things, that you've done or been exposed to, have eaten. That way you can more likely pinpoint your trigger of what causes your migraines.
Okay. So true migraine headaches are not a result of brain tumor or other serious medical problems. So only a healthcare professional or provider who specializes in headaches can determine if your symptoms are due to a migraine or other health condition. So it's important to see a provider if you experience consistent headaches that seem like a migraine. The goal of treatment for migraines is to achieve consistent, rapid headache relief with minimal side effects. and minimal symptom reoccurrence. So to treat migraines, there are several non-pharmacological treatments that you can do. So these involve things that do not include medications. You can apply ice to the head and recommend periods of rest or sleep. Make sure you get enough sleep every night, because that is one of the triggers that Holly talked about. Make sure you're in a dark, quiet environment, because these loud, bright environments can be a trigger.
Right.
You want to identify and avoid triggers. Like Holly said, keeping a migraine diary, noticing what may have caused that migraine to occur is very important. Yes. So you can avoid it and going forward. There are some behavioral interventions that you can do. This is mainly relaxation therapy and techniques. You could do meditation, peaceful time that you can set apart for yourself to be relaxed and avoid potential triggers.
Right.
So there are also pharmacological treatments. So you've tried the non-pharmacological treatment, it's not giving immediate relief. So what can you take? So there are several over-the-counter treatments that you don't need a prescription for. You can use Tylenol over the counter, Motrin, or ibuprofen, Advil. They're all in the same class of medications. They can provide more rapid relief for the headache. There's also Excedrin migraine, which has caffeine in it too. So that is shown to be beneficial to some patients. So after you tried these over-the-counter therapies, and if you're still experiencing recurrent migraines, it is recommended that you go to the doctor to see if they can provide you additional help and maybe some prescription medications that can help relieve migraine symptoms.
Thanks for watching our video today. Please like, subscribe, and give us a share. And always remember that you can find us on YouTube, Facebook, as well as Instagram. Thanks again for watching our video. Stay safe, stay well, and we'll see you next month.